QIC-AG, National Quality Improvement Center for Adoption and Guardianship Support and Preservation, a program funded through a 5-year cooperative agreement with Department of Health and Human Services, Administration for Children and Families, Children's Bureau in partnership with Spalding for Children, the University of Texas at Austin, the University of Wisconsin-Milwaukee, and the University of North Carolina at Chapel Hill. A title screen appears: The Challenges of Engaging Adoptive and Guardianship Families in Preventative Services, QIC-AG Annual Webinar, September 25th, 2017.
Welcome everyone, and thank you for joining today's webinar. Before we get started, I'd like to review a few housekeeping items and let you know how you can participate in today's session. Our meeting is scheduled for approximately 90 minutes, and to eliminate background noise, all phone lines will be muted during the event. If you would like to submit questions or comments to the presenters, you may do so by typing your question or comment in the chat window, which is located in the lower left area of your screen. When finished typing, click on the Send button to submit your questions and comments. Later in the presentation, those who called in using the toll-free number that was provided in your meeting confirmation email will also have the opportunity to verbally pose your questions by pressing *1 on your telephone keypad. At the end of the presentation, we will take as many questions as we have time for. Today's webinar will be recorded and archived for later reference on the QIC-AG website, www.qic-ag.org. We will send out email notifications when the recording is available. The PowerPoint handout for today's presentation was included as a downloadable file with your meeting reminder email. If you did not receive the PowerPoint handout and would like a copy, please send a chat message with your email address, and we will forward a copy after the webinar concludes. As always, we appreciate your feedback, and at the conclusion of this event, please take a few minutes to share your thoughts with us by responding to the survey, which will be displayed on your screen at the end of the webinar. I'd now like to turn it over to the Director of the National Quality Improvement Center for Adoption and Guardianship Support and Preservation, Melinda Liss.
Thanks, Ingrid. On behalf of the QIC-AG, I'd like to welcome all of you to the annual Lessons Learned webinar. This is the 3rd annual webinar that we've offered. In each of these webinars, we're trying to highlight information we're learning through the project as we work with the site. The webinar today will highlight 2 of our 8 partner sites, and that's Illinois and New Jersey. Both of these sites have implemented a valuable intervention in the selective interval on the continuum. Before we get started today with our presentation, I would like to introduce June Dorn. June is our Federal Project Officer. She is the National Adoption Specialist at the Children's Bureau and works very closely with us on this initiative. June?
Thank you, Melinda. Good afternoon and welcome from the Children's Bureau to everyone. I want to thank you so much for taking time from your busy schedules today to join this important webinar about the National Quality Improvement Center for Adoption, Guardianship, Support, and Preservation. At the Children's Bureau, we are very excited about the work being conducted and the interventions being tested by the QIC-AG. And it is our hope that what you learned today from the pilot site presentations will be exciting and helpful in informing the work that you do. In particular, we hope it will advance your understanding how to engage adoptive guardianship families and deliver services to them. Thank you again for your time today. Back to you, Melinda.
Okay. We are going to have 4 presenters today that will be walking you through the next hour and a half or so. The first person is Dondanita Fleary Simmons. She has worked for many years in child welfare. She is a site consultant for New Jersey and the Winnebago tribe in Nebraska, and today she'll be talking specifically about her work with New Jersey. We're also joined by Stephanie Hodge-Wolf. She has also worked many years in child welfare and is a site consultant for Illinois, Texas, and Wisconsin, and today she'll be sharing her information in regards to Illinois. And then we're joined by 2 of our site consultants. In addition to the 2 site consultants, we are joined today by 2 of our site implementation managers. We also call them SIMs, so in case you hear us refer to them as SIMs, The SIMs work on behalf of the sites, and they're responsible for leading the efforts within their site. They're aware of the environment, the people that we need to work with, and make sure this project that we're working with them on through the QIC-AG happens on a daily basis. They work very closely with the site consultants that I just introduced, and they will be walking through their experiences today with the QIC-AG in regards to engagement. So the two site SIMs that are joining us today are Christine Feldman, and she is with Illinois. She's worked with the Illinois Department of Children and Family Services in numerous capacities over the years, including work with many of the private agencies that provide post-adoption services in the state. We are also joined today by John, who is the SIM, or Site Implementation Manager for New Jersey, and he works for the DCF, Division of Child Protection and Permanency, and he's actually helped New Jersey to implement several large national initiatives.
John's full name appears as John Webb.
On this next slide, you're going to see the learning objectives, and I won't go through and read all of these, but I wanted to point these out because this is what we're really hoping that participants will walk away with today.
The 5 learning objectives are listed as follows. 1. Participants will become familiar with the integrated theory of participation and how it impacts implementation. 2. Participants will increase their understanding of the selective interval in the context of the larger QIC-AG Permanency Continuum Framework. 3. Participants will gain awareness of reasons adoptive and guardianship families may not proactively engage in preventative services. 4. Participants will learn strategies employed, decisions made by sites to try to improve the level of participation with adoptive and guardianship families. 5. Participants will understand the implications of the challenges with involvement on future service delivery for adoptive and guardianship families.
As Ingrid mentioned, we're going to ask you to complete a quick survey at the completion of the webinar. We really do value your general feedback. We also want to know whether or not we succeeded in providing you pertinent information about the topics that are listed here. So just to give you a brief overview of what we'll be doing today, Don Danita is going to provide us kind of a brief overview of the QIC-AG. For some of you it may be repetitive, and for some of you it may be new. Stephanie is then going to walk through the integrated theory of participation, and we'll use this as a construct throughout the rest of the presentation as the sites share information about recruitment and retention. We will then hear from each of the sites to talk about lessons they've learned in regards to recruitment and retention, challenges they face, as well as what they've done to try to mitigate some of those challenges. And then we'll be closed out today by Don Danita, who will be summing up what we're learning and how we might be able to apply this information to our work with other sites as they develop or enhance, I should say, their continuum of services for families who've adopted or obtained guardianship of children. So with that, I'm going to turn it over to Don Danita.
Good afternoon, everyone. This is Don Danita. And I just wanted to start with giving a quick overview and sharing a little bit about what the goals are of the QIC-AG. I am having trouble advancing the slide if somebody can help with that. So the QIC-AG recognizes that adoption and guardianship families, a population that now exceeds in size the population that is in foster care, and includes both publicly and privately adopting families, really deserves to have and to receive the best support and services that they can. However, there's a recognition also that there's not a lot known historically about what supports these families need and what works the best. So with that in mind, there are 2 goals. The first is to develop an evidence-based model of intervention or evidence-based models of intervention that support that can be replicated or adapted by other child welfare systems across the country. And the second is to achieve long-term stable permanency in adoptive and guardianship homes for the target populations, which we'll discuss a little more later. The QIC-AG is a 5-year cooperative agreement funded by the Department of Health and Human Services, Administration for Children and Families, Children's Bureau, and supported by invested partners that you see on the screen.
The 4 partners shown are Spalding for Children, University of Wisconsin-Milwaukee, University of Texas at Austin, and University of North Carolina at Chapel Hill.
It's also supported with the consortium of esteemed experts that are too numerous to list here, but who have been integral to informing and guiding our work. The work of the QIC-AG is occurring in 8 partner sites across the United States, and we'll share a little bit more about who those are later. As I mentioned earlier, the QIC-AG is focused on 2 target groups that you see here on your screen. Target Group 1, children with challenging mental health, emotional, or behavioral issues who are awaiting an adoptive or guardianship placement, as well as children who are in an identified adoption or guardianship home, but the placement has not resulted in finalization for a significant period of time. And then the focus of our conversation today, which is Target Group 2, children and families who have already finalized adoption or guardianship. This includes children who have obtained permanency in private guardianship or private adoption. There is a continuum that the QIC-AG has developed to look at the different stages from sort of the beginning before adoption all the way through the adoption process.
A flowchart representing the Permanency Continuum Framework. The chart begins with pre-permanence, colored in blue, and divided into 3 intervals: stage setting, preparation, and focus services. Next is finalization. The chart continues with post-permanence, colored in green, and divided into 5 intervals: universal, selective, indicated, intensive services, and maintenance. The 3 intervals of universal, selective, and indicated are further labeled as prevention.
And you'll see that there are stages that are indicated in blue and green, and those are the 5, we call them intervals, the 5 intervals where a group within the United States is working as part of the QIC-AG project. The first is the blue, the focused interval, and Texas and the Winnebago Tribe of Nebraska are both doing work in this interval. The next is universal, and Vermont is doing work in the universal area, and we may talk a little bit more about that. The selective intervention area is where you'll hear most of the presentation today. That is where New Jersey and Illinois are operating, and we'll talk a little bit more about what it means to be in the selective interval. Indicated is Wisconsin and the Catawba County in North Carolina. And then finally, intensive services in Tennessee. So we'll share a little bit more about that, but we wanted to just sort of have you to see visually the continuum and where we're talking.
A chart diagrams the average risk for discontinuity and intensity of intervention for the 3 prevention intervals: universal, selective, and indicated. Universal is marked as low, selective as moderate, and indicated as high.
The selective intervention is really prevention. So it's looking at families or children for whom something may have been known at the time that they moved in to adoption or guardianship that might give a hint or a clue that there may be something that you might expect to happen afterwards. So for example, in New Jersey, our selective intervention focuses on pre-adolescence because, you know, adolescence is a time when things are likely to bubble up in lots of ways, and one of those may happen as it relates to adoption or guardianship, and we want families to be prepared for that. Another indicator that we're using in New Jersey are families or children that have had some time in aggregate care. So it could be any particular thing, but the idea is that there's something that has happened in the past that gives us a reason to, you know, at least be ready for something to happen in the future, even though it may not ever happen. So it's an interesting group to reach out to because, of course, these are folks that are not yet experiencing any particular problem. So the idea of the selective is to prevent for their preventative interventions to target outreach to families that have risk factors for discontinuity. All of the services in the selective category are proactive in nature. The prevention efforts are targeted at families with characteristics known at the time of finalization, as I mentioned, that may put them at an elevated risk for discontinuity or post-permanency instability. Decades of research in child welfare have yielded significant insight into the characteristics, which are then used to identify children and families for proactive outreach.
A website URL reads http://QIC-AG.org/W as in whiskey, P as in papa, /content/uploads/2015/06/QIC-AG Continuum Framework Final March 6.pdf.
And now Stephanie will share with you a little of the challenge of doing that proactive outreach. Stephanie?
Thank you, Dee. So as Dee mentioned, here's where we've sort of landed, right? It's the challenge of working with families and helping them to get to preventative services when they're not asking for or seeking this type of support. And so this is the challenge that we're struggling with now. We'll talk more about what that's about. Basically, we have seen several different types of non-participation in both of our interventions in New Jersey and in Illinois. And this slide shows the types of non-participation that we've experienced. And so the first bullet that you can see here has to do with just not being able to make a connection with the family. And here we're talking about perhaps having an address that's no longer valid, not having a phone number, or having a phone number but trying to reach the Miller family and that phone number reaches the Jones family. So in these instances, we're just unable to really make contact with the families that we're doing outreach to. In the second type of non-response, we're really talking about here instances where we have been able to make a connection in that we're fairly certain that we have a valid address. We haven't gotten a letter or the flyer that's been mailed returned to us, or we've left a message with somebody in the home or on what sounds like the appropriate number by the voicemail that we receive, but we've not gotten any response back to this effort. So a little different than the first bullet where we just can't really even make any contact. The second piece talks about just not being able to get any response when we're fairly certain that we have reached the right person. In the third bullet, this is pretty self-explanatory. For those folks that we have reached, some of them have just refused the service. They've just determined that it's not something that they want. It doesn't necessarily meet their needs or doesn't fit into their schedule, and so they just let us know that, which is totally fine. In our fourth category here, we have no-shows. And so a couple of things here. We've got folks that when they talk with our outreach coordinators or their first point of contact for our project, they'll indicate that they like what they hear, that they have some interest in attending, they'll be there, or yes, sign me up. And then this is followed by a no-show. And while this certainly could be sort of a more passive refusal in that perhaps the family just wanted to find a nicer way to say no, so they never really intended to participate but didn't really want to say that, and so this could be a passive refusal. Or we do have some indications that there may be some families who had intentions to participate and their life just got in the way. We've just learned a lot about families being so busy with other activities and things that they're doing. And this was actually really emphasized recently in Illinois with a postcard that was returned several months after being mailed to the family with a handwritten note to our outreach coordinator that said, "Thank you for continuing to try to reach me. I really want to do this. It's just really hard for me to find the time. Can I still sign up?" And so, this is really just, again, one of those examples of somebody who may have been perceived really didn't want to participate, but this person certainly indicated they had an interest. They just couldn't sort of get connected in the way that they wanted to. And then finally, we experience some attrition in our programs. And so we have some families who sign up for the intervention. Maybe they get started, they have some initial level of attendance, but then the attendance becomes spotty or drops off. And so certainly we've seen some families who fall into this category of attrition. So I want to talk a little bit now about something called the integrated theory of participant involvement. And this graph or this chart that you're looking at basically sort of describes a way of thinking about how do families become involved and participate in services, and particularly voluntary programs. And the authors here, McCurdy and Daro, really recognized that many programs had identified issues related to low enrollment or retention, again, particularly when you're talking about voluntary programs, but there really was no basis to understand the factors that came into play around these low enrollment or retention issues. And so these authors set out to try to describe that. And the thinking was, if we know why and how individuals make decisions to use voluntary services, we could actually begin to develop our approaches to service delivery in a way that would increase retention rates and thus allow more people to make use of the services that we feel would be effective. So the authors here basically describe 3 phases of involvement or participation in services. And the 3 phases are represented with the 3 circles there in the middle of your screen. And they are intent to enroll, enrollment, and retention. And then the authors go further to describe various factors within these domains that impact each of the phases. And so it could be individual factors, provider factors, program aspects, or neighborhood factors that really influence each of these phases of participant involvement.
Expanding on the diagram, intent to enroll has individual factors as the primary influence and provider, program, and neighborhood factors as secondary influences. Individual factors are listed as attitude toward service, cost-benefit perceptions, readiness to change, subjective norms, and past program experience. Provider factors are listed as cultural competence and service delivery style. Program factors are listed as auspices and timing of enrollment. Neighborhood factors are listed as social capital and social disorganization. The overall intent to enroll is also a primary influence towards enrollment, while individual and program factors are secondary influences of enrollment. An individual factor is listed as subjective norms. A program factor is listed as duration between program acceptance and first service contact. Enrollment and neighborhood factors are secondary influences to retention, while individual, provider, and program factors are primary influences to retention. Individual factors are listed as objective and subjective program experiences. Provider factors are listed as cultural competence, service delivery style, caseload, and training. Program factors are listed as supervisory caseload, funding, staff turnover, and participant incentives. Neighborhood factors are listed as social cohesion and concrete resources.
I'm going to give you just a couple of general examples of some of these influences, and then you're going to hear from Christine and John about much more specific examples related to the projects in New Jersey and Illinois. But to just give you a general idea, under intent to enroll, one of the individual factors that can influence participation has to do with cost-benefit perception or one's perception of their risk. In other words, if you think you might be at risk for something, you may be more likely to enroll or participate in a program that's designed to mitigate the risks. Or if the benefits to your participation outweigh the cost, you may be more likely to participate. In terms of past program experience, if you've had a bad experience with another type of program, you may be less willing to accept a service from someone else. And likewise, the reverse is true. If you've had a good experience with another program or provider, you may be more likely to accept the service of somebody who comes along after. In terms of enrollment, here we are considering the impact of some subjective norms. For example, some parents may not want a provider to come to their family home, or they may not be interested in a service that requires too much of an active role, again, particularly thinking about the context of a preventative service. If you have very quick time between the enrollment into the program and the service delivery, this might correspond with higher enrollment rates. In terms of retention, when you're talking about an individual program experience, so once the person is involved in the program, if they experience a very smooth delivery of service, it's very stable with the same person working with them over a period of time, and it's delivered as planned, then these families may be more likely to stay involved in the service. Likewise, if you're matching your program goals with the personal goals of the individual, this can also be really important in terms of retention. So what I'll do now is turn it over to John, who's going to talk about the New Jersey project and give even more specific examples of these different phases of involvement as it pertains to their project there in New Jersey. John?
Thank you, Stephanie. And yes, I will start to discuss some of our specific examples. But what I wanted to do first was provide like a brief overview of our intervention. I think it does make sense to do that so that folks on the line can understand what program we're actually implementing and then how that might relate to the work we're doing on recruitment and retention. So Tuning Into Teens is the name of the program. Throughout most of the presentation here, I'll refer to it as TINT, as Tuning Into Teens can get long to say. But TINT is a 7-session emotion coaching program designed to proactively increase parents' capacity to understand and respond effectively to their child's emotions, and thereby help their child to develop and improve emotional competence. Such improvements in emotional competence have been correlated with a number of positive outcomes, including strengthening the attachment of the caregiver-child dyad. Under the supervision of the purveyor, the TINT model that we have was adapted to ensure the curriculum addresses the special dynamics common to families formed by adoption and guardianship. And what parent honestly can use some assistance in these areas? TINT is a manualized workshop program, but it gives the group the opportunity to organically move the discussion into areas of concern or success, allowing for additional time to be spent on key issues that the family brings up. Inside the workshops, we hope that the program will help parents to do a number of things that I'm going to list. We hope they understand the relationship between their children's emotions and their behavior. We hope to support their children to manage strong emotions and deal with conflict. To use their children's emotional experiences as an opportunity for closeness and teaching, to gain awareness and learn to regulate their own emotions, to develop skills to assist children to verbally label their emotions, to develop skills to assist children in problem solving, and to guide children's behavior with appropriate limits. TINT's philosophy says that if a family increases their communication, connection, and emotional awareness, that it will lead to decreased behavior problems, improved relationships, and less conflict. That's pretty cool. Another unique element of our program comes from a decision we made early on in the intervention selection process, that we would want to enhance whatever intervention we selected by including an adoption and kinship overlay into the intervention. For our purposes, this meant that we would be sure to support the unique needs that our post-permanency families have. And to do this, we formed an adaptation work group, which was charged with making thoughtful and meaningful additions to the Tuning Into Teens manual. Those changes came in the form of an overlay. The overlay is used by the workshop facilitators as an enhancement to the core TINT curriculum. The adaptation work group consisted of parents and professionals from the private and public adoption world. This group and the overlay it created was supported during the entire process by TINT's purveyor, who participated directly in the development of the adaptations. Again, that was great support that we had from the purveyor of TINT, who I should add, TINT is a program that was developed all the way in Australia. So sometimes it was challenging to include the purveyor in our discussions, being that she was, a full day ahead of us. But we found some common ground at 8 p.m. Eastern Time, which I believe was like 9 a.m. the next day over in Australia. And we had some really good conversations with her, and we continue to have good conversations with her throughout this process. So we feel very supported by the purveyor of TINT.
Additional information provided is that TINT served the population of families who adopted or assumed kinship legal guardianship of youth between age 6 and 13, eligible for intervention when youth are 10 to 13. The intervention rotates around the state. Intercountry domestic adoptive families with children aged 10 to 13.
Okay, so now we get into some of the things that Stephanie laid out in that chart. And what I hope to do is go through some of our actual strategies and factors that have helped shape our Tuning into Teens program. And what I wanted to say about it is we spent a lot of time in our planning stages discussing intent to enroll strategies. This is the first slide here. Especially around intent to enroll, we spent a considerable amount of time bouncing ideas, brainstorming, and coming up with what we thought would be unique characteristics of our program that would help us out. And honestly, the time that we spent on it was really good because it allowed us to parse through some of the more traditional practices that we've been using as an agency in the past and begin to recruit families or redirect our efforts towards recruiting families in a different way, knowing that the population that we were trying to serve hasn't necessarily been targeted for programming or hasn't been targeted for programming from us. And let me give you some examples of things we did to increase our intent to enroll characteristics. One of the main things we did was use language in our invitations that was more inviting, thoughtful. We tried to say the words workshop, not training. I know a lot of our families have gone through considerable training to become an adoptive parent, often mandatory. And when you start to throw out the words like mandatory, training, it could rub some folks the wrong way. And quite honestly, our intervention is not mandatory, and it isn't really a training. It is more of a workshop. So we wanted to be clear that we were setting this up in that manner, where we were asking families to participate in workshops. Also, in that vein, we used our stakeholder team to help us craft these invitations that we sent out. These stakeholders are adoptive parents or staff from the adoption field who all came together to give us tips and themes to kind of make sense of what they would want to hear if they were being asked to be invited to a training or a workshop. So it wasn't only up to us to come up with the language that we thought would be important, it was up to the team to kind of differentiate what it would take to pique the interest of a family that is adopted and also make them feel comfortable. So another thing that we spent a lot of considerable time thinking about, and now we can spend a considerable amount of time working on, is training locations. So we decided to pick community locations or sites that families were aware of already or could be easy to Google. So I'm talking about YMCAs, churches, boys and girls clubs, firehouses. We stayed away from using our state offices for meetings, simply because we don't know if families had good experiences there or not, but we wanted to give them the opportunity to come to a fresh location. Also, many of our state offices have moved since that family may have adopted. So that gives us the opportunity to bring our trainings into the community and provide that community feel when the families are attending. Another very individual factor that we focused on was calling families. And boy, do we call families. What we do is our recruitment process starts with a save the date. And the save the date goes out about 7 weeks before our training start. That save the date is essentially just giving the family information about the class, about the program, and letting them know to look forward to an invitation. A week later, families get our formal invitation. Again, this is via snail mail. The formal invitation provides more detail about the class and an opportunity for families to call and register to attend. So as you can imagine, we don't get a ton of people calling us on their own after they get those two documents in the mail. That's when our call process really kicks in. We will call families up to 4 times in a recruitment cycle, and our calls start the week after our formal invitation goes out. That is followed up by another call during that week, which takes place at night. We wanted to add that additional call at night because often our families are busy during the day and at work or taking care of their children. So we wanted to add that additional call at night, hoping we could get some more folks to answer the phone at night and engage them at a different time. So finally, if neither of those 2 calls have been effective in reaching a family, we will call again on the next week a 3rd time, and then the following week we give them one more call as a sort of last-ditch effort to reach out during our call process. So in total, they get 6 touches from us within about a 4-week period of time, to try to enhance them, to give us a call back, or to register for class. It is a lengthy process, and I think Stephanie and Dee mentioned some of the things that are going on in terms of why families say no. One of the main things is we don't have correct phone numbers. Families change their phone numbers, as we all do at time to time, and they're not necessarily letting us know that they've changed their number. We get a lot of voicemails. Now, I don't know if this is the same in other parts of the country, but here in New Jersey, we have a huge robocall problem where we are getting constant calls from agencies trying to sell us insurance or sell cruise. I want a cruise. I've won so many cruises. It's crazy. So that has been challenging because families that we're calling aren't going to necessarily know our phone number and are way less likely to answer a number that they don't know. So we do have pretty good success with families answering the phone on that 1st or 2nd call. As we go deeper into the calls, it's less likely that families will answer, and oftentimes our wrong numbers stay wrong. Imagine that, the whole time that we're calling families. So it is a laborious process, and I will actually talk a little bit more about how we go about that with our subsidy staff in a few moments. Another thing I did want to mention in the individual factors was that we provide food for our families each week. This cannot be overestimated here. We also provide food from local restaurants, and it has become a really good way for our families to bond. We've noticed that sometimes it might be the only meal in that week that our families that are attending TIN haven't prepared themselves, which is always a treat. And I think this is one of those individual factors that transfer over to retention as well. If you know you're going to get if you know you're going to get a freshly prepared meal for you, you're more likely to attend. But it is something that we use as an enrollment strategy because we put that out there and say, hey, look, this is an opportunity for you to get a meal. Hey, why not?
One additional individual factor is
and if you take a look at our program factors here on the slide, you'll come by. And if you take a look at our program factors here on the slide, you'll see that members of our subsidy unit have volunteered to make our recruitment calls on top of their already busy days. So we've asked our subsidy staff to volunteer to make these calls for one big reason, and that is that our subsidy staff have a tremendous amount of experience speaking to our target audience, adoptive families. It's a big investment of time and energy to train and prepare the subsidy staff to make these calls, but we feel it's well worth it. They are well prepared to handle any circumstance that an adoptive family may present to them on a phone call. Ultimately, we want to make the adoptive family as comfortable as possible when they answer that phone with a number that they don't know. As good as our subsidy staff is at relating to and communicating with adoptive families, they couldn't recruit for TIN without some guidance. So we developed a script and a bulleted list of call information that we give to the subsidy staff before they start making calls. gives them the opportunity to make themselves feel comfortable speaking about TINT and allows them to present the key information about the program in a concise manner. We also spent some time training our subsidy volunteers on the main program elements of tuning into teens in an effort to educate them as much as possible prior to that first call. I'm happy to report that our subsidy staff volunteers are now a group of well-oiled machine-like recruitment callers and have been as valuable to the implementation of TINT as anything else. All this work planning, setting up locations, and calling folks, and we still don't have them enrolled, right? So I'm going to talk a little bit about our enrollment strategies here. One of the first things that we did was give families a choice of enrollment location. So being that we run this program in a statewide manner, and families that are selected randomly are allowed to attend any of the locations that they're invited to. So here in New Jersey, we usually run things by counties. So County A, it gets invited to something that they can go to in County A. County B, invited, can only go to County B. But for this implementation, we decided that we would blur the county lines and allow folks to choose which one they wanted to go to. And one of the things we did around that was cluster some of our locations together. So giving them a choice only makes sense if we allow them to realistically get to 2 different options for the workshop program. We typically try to schedule them on different nights of the week if they are next to each other so that families can choose, I would like to go to location A because it fits my work schedule, or vice versa if location B is better. This also gives families the opportunity to say, hey, you know, I work closer to a location away from my home, and I could just shoot over there after work and make it happen that way. So this was a good thing that we did, and I think it's helped a few families make decisions about coming. Next, turkey sandwich call. So this is you know, we'll hear a little bit about, you know, and we've started to hear about it today, is that our idea of our families in New Jersey and Illinois are registering for our programs, but only about half of them are really attending sessions regularly. So one way we've tried to combat that is through our turkey sandwich call. And what the turkey sandwich call ends up being is another potential connection with our family. It's meant to go above and beyond a standard reminder call. And it's trying to put the person that's answering the phone, the family that's coming, in that room on that night and have them imagine what they might be eating on the night of training. So I mentioned before that we provide food for each session. So what we try to do is call our families back about a week to 10 days, maybe 2 weeks after they initially register. And we say to them, hey, remember you registered with us? And they say, oh, yeah, it's great. Really looking forward to it. And we say, hey, what do you want for dinner that first night? The first night we are able to pick our menu a little bit more descriptively. So we have turkey sandwiches, we have roast beef sandwiches, we have Italian subs. And the families will respond and say, hey, you know, I want whatever they want. And we really hope that, and we think it works a little bit like a social contract, where the family feels that we are really thinking about them and want to make them comfortable. In turn, they will actually let us know if they were coming to that first session, and or it puts it back into their head that they need to make you know, a commitment to coming or not coming. And we get quite a few families that, you know, are appreciative of the call and say, that's you know, it's a really nice thing that you're doing. Thank you for thinking of me. We also get a number of families when we make that turkey sandwich call that say, oh, you know what, something came up. I can't attend. Now, that also helps us with planning because we're starting to know which families are coming and not coming, and it helps us with the budget. So we have to buy less turkey sandwiches. So overall, I think it's been a really effective little trick that we've been using to help our enrollment strategy. Another thing that we talk about is the idea of a date night. So caregivers can participate with or without a spouse, and some of them look to take advantage of this and come with their spouse. You know, like I said, food is there, so it's almost like they have everything going into a date. You know, in reality, though, it is very difficult for families to get childcare, and to make arrangements for 7 consecutive weeks for a training 2 hours a night on a weeknight. So we do give families the option. They can come with or without their spouse or partner. Okay, some program factors. We send out a letter and email with all the reminder information. So we time the letter, the post office letter, to arrive a day or two before the training, so folks have a hard copy of the information like the time, location, and address. We also add detailed instructions on parking or mass transit if we have that available. So we really like that concept because a lot of times people are scrambling around. We're all busy. Families with teenagers are very busy. So if they have that fresh out of the post office, fresh out of their mailbox, they're less likely to throw it away and more likely to grab it and say, hey, you know what, we got to go to this. And oh, look, it has all the information that I'm going to need to get there. They're not having to scurry around trying to find email or trying to call people back that might have called them. Our reminder email and letters, as well as the turkey sandwich call, help us bridge the time gap between registration and the start of class. Folks may register a number of weeks out and need that reminder to put it on their calendar or tell their spouse they are going. I know I would be the one that put it on my calendar and said the day before to my wife, oh, by the way, I signed us up for a 7-week program. So that's why I like that extra reminder. Another key element of our enrollment strategy is a reminder call that we make after session 1 if a family doesn't attend. We call and check in, ask if they'd still like to attend, as the program allows families to start in week 2. And then we try to determine if they say no, we try to determine a reason that they were not able to make it. It just helps us with planning. We often get a response from families on this call indicating that they will attend next class the following week. But often they do not attend that next session. So we feel that they might be just being polite about not coming. But on occasion, we do have a family that we call after missing session 1 who is genuinely eager to attend and does attend session 2. And let me change the tone of that sentence. I think many of our families are eager to attend, but there are so many factors that are providing speed bumps for them attending. So it's not necessarily a bad thing if they do not come. They may have the intention to come. We'll talk a little bit about our retention strategies. Some of the things that have really kept TINT families coming back are listed here in this slide. The first one I'd like to highlight is that the families who attend TINT can put their newly developing skills to work right away. In fact, there is a home assignment after each session that allows for families to practice their skills at home. TINT is not overly complicated, and our families pick it up rather quickly and with some success. Our families often report coming back to week 2 or 3 with stories of how they have used TINT at home and already feel a difference with their child. Another important element of it is the families are coming back to class reporting that their kids are aware that they are changing the method of their communication or trying to help identify emotions with them. We get comments all the time like that families are saying, my kid said you're trying your stuff from class on me again. So it's really quite funny that the families are reporting back that the kids are so observant and they pick up on this stuff so quick. And honestly, our facilitators are really the best. Collectively, they have a tremendous wealth of knowledge and compassion around adoption. And they've really taken to tuning into teens as a parenting style. Just to let you know, our 20 trained facilitators had not been trained in TINT prior to this project, but all are very experienced in working with adoptive families. If you sat in one of our classes, you might not even know that this program has only been implemented in New Jersey for about a year, and most of our facilitators have only trained 1 or 2 classes. This speaks to the preparation and dedication our facilitators show on a consistent basis. Now, if you're wondering how this relates to retention, it's simple. Our facilitators are eager to be a part of changing our families' lives for the better. So how do they do this as part of TINT is by going above and beyond. We have mostly dual facilitated classes, and those facilitators meet on their own time to divide up the lessons and role plays. They fill out fidelity checklists and facilitator notes to help the folks that are outside the classroom stay informed on what's going on inside the classroom. They attend ongoing supervision calls with TINS purveyors. And last but not least, they are completely flexible with meeting the needs of our families. If a family needs to go over something at the break, they do it. If a family needs to come early to discuss some things that aren't working out at home, our facilitators are there. They really do bend over backwards for our families, and it makes retention of families so much easier.
One additional individual factor is listed as received certificates of completion for attending. 2 additional provider factors are listed as teams of facilitators chosen to support groups, varied professional experiences, racial and ethnic backgrounds, and a maximum group size determined to maximize manageability.
Some of our neighborhood factors are really quite fun to report on. Our families bond over the 7 weeks they are together, and let it be known in a number of different ways. That bond really keeps our groups going strong, not only with attendance, but also with investment into the program. Our first group of classes that we ran naturally started a potluck dinner at week 7. And now it's something that we mention to all our groups as an option. So it started organically where families said, hey, you know what, in week 7, it'd be really cool if we all brought in a dish and shared it, as part of our family. And it was so successful that we've had to scale back our food orders for that 7th week, and because the families are bringing in so much food and really enjoying that time to bond. Our families swap information with each other early on in the process. These are families that may or may not have a lot in common, but have one big thing in common, and that is that they have an adopted child between the ages of 10 to 13. We've enhanced that connection by asking a question in our first icebreaker session during session 1, which is, what brought you into the room tonight? As you can imagine, there is a lot of nodding and agreement as each family goes around the room and talks about the trials and tribulations of having a teenager in their home. Our groups are safe for sharing, and one of our ground rules talks about privacy and confidentiality outside of the meeting rooms. This definitely makes the families feel better about sharing often very personal details about their home life. Another retention factor that we considered is money. Money always talks. Our families are reimbursed for childcare and mileage in the form of gift cards. And it really means a lot to the families, both in the sense that life costs money. Gas is expensive, babysitters are hard to come by, parking and tolls in New Jersey border on the absurd. So our gift cards to families go a long way in making them feel taken care of, both financially and emotionally. And now, that basically wraps up my portion, but before I pass it over to Christine in Illinois, I'd like to share a response one of our families gave to a satisfaction survey question on what TINT meant to them. And it goes like this, quote, "What I found to be most useful about this program is being able to connect with my teen on a level that allows me to understand what my teen might be feeling in times of difficulty and sadness, as well as times when things are going well."
One additional neighborhood factor is listed as Received Adoption, Kinship, Legal Guardianship Service Booklet. Program factors are listed as on-site observations of facilitators, check-in reporting and sessions, and fidelity checklists. The incentive package for participants includes ongoing reimbursement for travel and childcare, participation in Adoptive Parent KLG conference, topic-related book, and $25 for survey completion.
So with that said, I'd like to thank you all for listening, and I believe I will be passing it over to Christine Feldman from Illinois.
Actually, before you pass it over to Christine, there's a couple of questions, John, that are specific to New Jersey, so we'll take just a couple minutes to answer a few of those. If we don't get to your question during this time period, we will be answering questions at the end as well. So one of the questions is, I think you already answered about the type of food that's served, but do you have an idea of the general expense per session?
The general expense per session can vary. That depends on a number of things. Food is pretty standard. It's a standard thing. It's usually between $10 and $12 per person. But some of the other costs that are associated are related to space rental. So some places are more likely to give us a rental at a free or discounted rate, while other places are a standard rate, which vary between, on the high end, from $150 to $200 per night. So if you add all that up, it depends on how many folks you have attending your training, but you can get a general sense that the cost would be in those ranges.
And how many of the 10 facilitators are adoptive parents?
So that's a good question. I am aware of 2 of our facilitators who are adoptive parents.
Okay, and then
like I said,
question. Oh, go ahead.
Sorry, Melinda. Like I said, we have a stakeholder advisory team, which consists of a number of adoptive parents and professionals who partake in planning and implementing tuning into teens. So I'm really happy to have them as part of our team. It's been very important to us.
Okay, and the next question is, how are facilitators retained? Are they paid?
Yes, so we have a unique situation here in New Jersey. Half of our facilitators are clinicians from the field. They're from private agencies, but they do have adoption background. The other half of our facilitators are folks from our child welfare system who have a long experience working with adoptive families. And what we do, which I think is very unique and very interesting, is we typically will pair those one facilitator from each group together to run a training. And that gives us a wealth of experience and diverse experience. Now, unfortunately, we're not able to pay our DCF employees with money, but we are able to reimburse them for their travel, and we are able to give them comp time right now, so their hours worked are counted. Then the private clinicians who work with us on the TINT program are paid money.
Okay, the last question, Michael, we're going to get to part of your question about the engagement rate a little bit later in the presentation, but he also followed with the question is, what do you do to overcome honeymoon or we are good healthy family dynamics that would reduce prevention engagement rate?
So that's a good question. I think it's something that we're all sort of bouncing around. But the way that I would handle it and what we've experienced is that we get a lot of folks who we call on the phone and they say, yeah, I'm fine. Like, I don't need a service right now. And what I'm understanding from the project at large is that's perfectly understandable. Most families are in need of an intervention, but the ones that do, we want to be there for them. So, they're in any group and any intervention that we're running, we would assume that many of the folks that we might be inviting are not in need of the service.
Okay, last question, John, then we'll turn it to Christine. If people have additional questions, they can ask at the end, but the last one is just a quick description of the Adoption, Kinship, Legal Guardianship Service Booklet, which is currently on the slide that's being shown.
Yes, sure. So we're really lucky that our subsidy unit here in New Jersey has developed an adoption and a KLG booklet. KLG stands for Kinship Legal Guardianship, and I know that's something that that acronym is different in other states, what folks call it, but it's a post-adoption booklet that talks about the services that are available to families who've adopted or are providing guardianship for a child. So it's a really cool little booklet that we've created that highlights all the important numbers to call, all the important agencies to be in touch with, and it's really like a one-stop shop to get some services that the families might need.
Thank you. Okay, Christine.
Okay. Good afternoon, everybody. Well, I'm here to talk about our experience in Illinois. The name of our program is, we call it Target, a term that's quite often used everywhere, so pardon the pun when I use it again and again, but it stands for Trauma Affect Regulation, Guide for Education and Therapy. And here in Illinois, when we decided what population we wanted to reach out to in terms of our prevention efforts, and then also what intervention we were going to actually use to benefit our families, we had convened a number of groups of professionals in the field. We called that the project management team. These were professionals and adoptive parents. We also have convened an implementation team, which meets every other week to talk about how we go about implementing this quite complicated program. And then we also have, most importantly, our stakeholders group, which is actually the Illinois Adoption Advisory Council of adoptive parents and professionals, who have been very good about giving us guidance when we've asked in terms of helping us to reach out to families who, as we have pointed out here, haven't reached out to us and don't know perhaps that services are available. So the population that we wanted to reach out to were families that had adopted or subsidized guardian children that were adopted through DCFS, the Department of Children and Family Services here in Illinois. And they would be kids that were preteens from age 12 to age 16. We can't provide services to the whole state, so we targeted areas of the state where there were a larger population of young teens that would be appropriate for these services, Cook County being the largest county. And then also there were 6 counties in the central part of the state down around Peoria and Bloomington, Illinois, where there were also a number of children that we wanted to reach out to in order to have a variety of population to offer the intervention to in order to see how it works statewide. In addition, we also reach out to intercountry and domestic adoptive families, and the age group there is age 10 through 17. And I should mention that in Cook County and central Illinois, the age group actually is between 11 and 12 and 16. So we really are working towards the young teen and the older teen. Now, what we decided to do in terms of the intervention and what do we think kids really need? How do we be preventive with people who haven't called us up and said they needed something? So we wanted to find a program that would benefit teens in a way that didn't sound, even though the title says therapy, didn't sound so much like therapy. After all, we are working with teens, and teens maybe don't want to sign up for therapy. So we found this Trauma Affect Regulation Guide for Education and Therapy, which is really about emotion regulation. It's about how to deal with stress. It's about how to find recognize what your triggers are and being able to focus and then to make a good decision to solve the problem that's in front of you. And then how to potentially find out really what your real values are and make a good life for yourself and a good life for your family and your community. These are called freedom steps. They're actually 7 steps, and they're taught to the youth and the parent, who's strongly encouraged to participate, in a series of 8 to 12 home-based sessions. I would say that it's probably more likely 12 to 14 sessions, putting in time for the orientation period as well as time for a very happy graduation date. And as I said, the idea is really to have the youth recognize that the neurobiology of the brain has been affected by post-traumatic stress, and to learn ways to really regulate that and to recognize their own strengths. It's very much a strengths-based program and very much nurturing in the sense that it reminds the child and the parent how valuable the child is to the family and how valuable that child has so many things to offer to the family, that the family welcomes that the child has been added to the family as part of the adoption process. The function of how we made this work is that we send letters out. Again, we had very good advice about sending the letters out to all of our the adoptive and subsidized guardianship families that are on our list. We have outreach coordinators, one for the Cook County area, one for the Central Region area, with a very strict protocol for how to call, when to call, a script to follow, and a very systematic way to follow up. And then the folks that deliver the services are what we call target facilitators. Sometimes we call them coaches, since that seems to be more popular. And they are master's level, for the most part, therapists, very experienced in the field of adoption. And they are the ones that actually go out and deliver this very manualized program following the 7 freedom steps and helping the child recognize how to control emotions.
Additional information about the target intervention includes, although not required, parents or guardians were strongly encouraged to participate with the child in the intervention. The topics included emotion regulation, impact of trauma, recognition of triggers, thoughts and emotions, and decision making.
Now, we really thought over how to apply some of the concepts from the integrated theory of participation to working on our intent to enroll. First of all, everybody wanted to think in terms of an intervention that anybody could use. So it's beneficial regardless of whether the child is experiencing difficulty. So it doesn't have a stigma as such attached to it. It's everybody, when I say everybody, recognizes that somebody who's a teenager, well, that could be a difficult time. There's really no stigma to having a teenager having a difficult time. And that what we were offering was something that helps people with teens. And certainly the stresses that teens go through themselves, as well as stresses that they put on their parents. So we selected something that would be very attractive from that point of view and would inspire the parent to sign up, to feel like they could potentially have need for this service because it affects day-to-day life that we all are going through at this time. We also wanted to point out that what this is also skill building. We discovered right away from feedback from kids that the idea of therapy wasn't attractive, or they'd been through therapy, or they'd been through counseling, or they saw this as a negative. So it was very important that we had a strategy or a beneficial program that was going to deal with learning a skill, how to control your own emotions with different steps that you could follow, and you have immediate success when you're able to go through the strategies and come out with a better result and get praise from parents and teachers and so forth. So it was more skill building than just therapy. Another thing is that when we talk about a target population, and you identify somebody who hasn't identified themselves, again, the fact that they had a teenager made them more likely to enroll because they recognize that potentially things could be coming along in the future with Facebook and violence and movies and peer pressures and all of those things, that being able to control emotions would be very beneficial, and that the time invested, because that's really the only thing they had to invest was time, which isn't easy when you have a busy schedule, but there really isn't a cost. It was another thing that our stakeholders advised us about, is to be sure to advertise that it's free, and that it would be very beneficial to the family without, them having to put out much more than hosting somebody in their home, somebody coming to their home. Another thing that we felt was really important is that to refer to other positive experiences families in Illinois have had, and that is the cafe style, which was part of the foster parent outreach, and then some adoptive parents have that kind of same outreach. So we're using that strategy to enhance enrollment in the central region, where coming up in October we're going to be sending out letters and flyers and inviting parents to an event where they can come together and talk about stress, and then talk and hear all about Target and see what that would benefit, how that would benefit their family. Another thing that we've done to enhance our enrollment strategies is that we had our project management team and our implementation team and the stakeholders team advise us about the letter and the flyer that went out. The letter was almost built by committee, so everybody had something to say about how the letter should be worded and what the flyer should look like. And after some of our initial mailings, some of the feedback we got is taking words out of it, not to be so wordy, making it more colorful, hinting to parents that there might be issues having to do with adolescence, and that's why this particular program would be very, very valuable. So another thing that we decided too in terms of a program factor is that some people didn't see that a program that came directly out of the Illinois Department of Children and Family Services, some people didn't want to take a program that came from the state agency. We took that advice and took some of that language out of the writings that we had, out of the letters that we had, so and emphasized more that the work of the private agencies. Now, in terms of our enrollment strategies, first of all, something that was very important was that we would offer it in the family's home. And this is a positive in Illinois. First of all, to keep in mind that not only urban but rural families are very, very busy. To be able to get a babysitter to take the child to some place would be a big barrier. So that it was very important that having somebody come to the home just solved all of that. It made it much easier to not only capture the child, but also the parent or another caregiver that might be in the home, like a grandmother, or some of the other children that might be in the home. One of the things in terms of enticing people to enroll is to make sure that the parent understood that they're encouraged to participate, but it's not mandatory that they participate. And they also, we found out very often, it wasn't the teen that was targeted that was in our list. It also, the parent might say, well, that child's doing okay, but I've got, two other teens that are in the home that I really feel would benefit. And so we were able to enhance enrollment by including other family members, other children in the as part of our outreach. And also another thing that our various committees pointed out to us was that sometimes the parent wasn't sure about what all this was going to be about. It sounded good, but they didn't know the facilitator, and let alone having a stranger like that come to their home, they weren't quite sure about it. So what we were able to do was to offer having the facilitator come and do an orientation with the parent. And in this way, the parent was to see immediately the value, and then the parent could decide to have the facilitator be introduced to the child and then plan the next session. Another thing that's really important that and we've had this in Illinois too with some of our adoption support and preservation agencies, is that when this is a program factor, is that when a family does say yes, they need to be brought in right away. Certainly the outreach coordinator assigns the target facilitator, and then as part of our case flow process, that facilitator would then make a very timely call within 3 days as part of our protocol to call the parent and make the arrangements to get in there right away, because as some of the research shows, if there's a lag between the time the parent is introduced to the program and then a lag when they actually sign up, that there can be so many intervening factors that would take away from that initial enthusiasm for signing up for the program. Now, in terms of our retention, some of the keys to retention is that we're flexible. That we keep in mind that the session can be, we say 8 to 10, but can be longer, a longer period for sessions. That's a pretty big time commitment. And also families with young teens are very, very busy. So we had to be flexible. We added extra staff to be able to accommodate weekends, Saturdays. I mean, that's been absolutely very, very important. We've had great feedback on that. I mean, there are some families that we can meet Tuesday night at 7 o'clock. And so we have a facilitator who can do that. Or we'll only meet Saturday afternoon because they want to have 3 or 4 different members of the family take part in the sessions. So we were able to do that. And that was a good example of how we have been flexible in scheduling. In addition, we are flexible in the sense that sometimes in the summer it was, families felt that it would be more beneficial to have the sessions closer together, so 2 times a week, for example. Or some people say, that sounds really good, but I can't do it until spring, or football season is over, or whatever. So again, we were flexible in that way. And then another thing that added greatly to retention is that the facilitators are very well trained. The training is for the target program is pretty intense. The preparation is also very intense. So they're very well trained. The caseloads are low so that they can give plenty of attention to the families and also plenty of time to prepare, as well as that they are provided with fidelity monitoring and coaching. So they themselves have a coach. They have a coach to coach them on delivering target, so that if they have any questions, they're able to talk through and come up with creative strategies to reach out to individual families. And then also we added at the very end, we had the program factor of we had a $25 gift card. We put that in at the end. Now we've added it in the middle. Families say that's very, very nice. They appreciate that, but it doesn't seem to be the difference between coming into the program or not. I would have to say that the feedback we get from families who say it made all the difference in attitude and in school functioning and in home functioning, that's been very strong. I mean, when we've asked for kids to really give testimonials about whether they've enjoyed it, they're saying, I'd really like to share this with other kids. I would really like them to know how much this helped me. So that's our program here in Illinois. It's an ongoing strategy. We learn something new every day from our families, and we certainly hope that this will lead to overall service enhancement, service delivery to already the array of programs we have here in Illinois.
2 additional individual factors are listed as being able to defer participation at outset, but can also take a break during delivery if needed, and client satisfaction surveys completed at mid and end points.
Thanks, Christine. We're going to actually move straight into the next session just because of time, and then we'll try to address the questions at the end. So, Donita, I'll turn it to you.
Okay, thank you, Melinda. I think it's important before we even move on to the next slide to understand that we are doing this as part of a research project. And I don't know how much we've kind of emphasized that as we've talked about this. So all of these recruitment strategies really have to do with maintaining the things that we need to do to have a good randomized controlled trial. And so they're not necessarily the things that you might do in another site to engage these families in these interventions. And I just think that is important to say as we move forward. So let me move on to slide 27. As I said, I'm having trouble advancing slides, so somebody else could do that. Thank you. This slide shows the uptake numbers in New Jersey for their evaluable intervention, which was TINT, as of January 2017. So we've completed several more rounds since this slide was taken. The red part of the pyramid shows the number of families included in the sample.
350 families with teenagers and risk factors were selected to be a part of the target population.
The green shows those families that were randomly selected to receive information about the intervention.
233 of the 350 families were randomly assigned to the intervention group. Letters were sent to those families.
Of those that received a letter,
116 of the 233 were contacted by project staff.
About 50% could be reached by phone, and as John talked about, several attempts by phone as well as a couple of attempts by mail. The blue area of the pyramid shows those that were contacted and who agreed to participate. We'll call that the intent to enroll.
59%, or 69 of the 116, registered for TINT.
The last area on the pyramid shows those that actually attended, or enrollment.
32%, or 22 of the 69, who registered attended all or most sessions. 4 attended some.
The pyramid does not show retention, but we can say, and I think John kind of gave you this information, that retention in New Jersey has been very, very good. They bond and form a connection. And so as we were told to predict by the purveyor, if people stay around past that second session, they're likely to complete. And we've certainly seen that to be the case in New Jersey. In essence, this shows that even after numerous attempts to engage families proactively, the percent that actually participate is really quite small. Next slide, please. Slightly different story in Illinois and Cook County, and also a slightly different method for bringing families into the sample. So this slide shows the uptake numbers for Chicago and their evaluable, which you just heard about Target from Christina, and also as of August of 2017. The pyramid looks different than New Jersey because of the type of evaluation design that's being used. Like New Jersey, Illinois is offering the intervention in the selective interval that focuses on targeting families with preteens and teens. Like New Jersey, we are seeing that even after numerous attempts to engage families proactively, the percentage that actually engage is not large. The red part of the pyramid shows the number of families included in the sample. Unlike New Jersey, this includes both those that will ultimately be randomly assigned to receive the evaluable intervention and those who are randomly assigned to receive services as usual, so not get engaged in the intervention.
304 families were sent letters.
The green shows those families that could be contacted after numerous phone and mail attempts, and like New Jersey, the percentage is 50%.
152 spoke with the worker. 13 requested a call back.
Once contacted, the families had to say that they were interested in obtaining services and provide consent. For the purposes of this presentation, we'll refer to that as the intent to enroll for this sample.
30 consented.
You then see that the pyramid splits off, and half are randomly assigned to receive target, and the other half are eligible for services as usual. Even after agreeing to participate and consenting, you'll see that there's another drop-off that comes when families, once they hear about target, decide not to participate.
15 families in the intervention group and 15 families in the comparison group.
You see yet another decrease in the number of families that actually attend the session.
67%, or 10 of the 15, agreed to participate. 2 attended at least 4 target sessions. The case status is 0 graduated, 6 open, and 4 closed.
Next slide. So if you look at the update numbers from the sites, you'll see, or the uptake numbers, I'm sorry, from the sites, you'll see that there is similarity in the percentage that we can reach and make a live offer.
The percentage of families sent information about the intervention that could be reached, contacted, is 50% in both New Jersey and Cook County.
I'll add that in New Jersey, one of the issues, and I don't know if it's true in other sites and states, is that people have gone to sort of automated check processing now, and so you don't have the addresses and phone numbers at the ready in the post-adoption units that you may have had in the past when you're actually manually sending a check to a home. So it has changed the ability to make contact. The next line shows the intent to enroll. Both sites have a drop-off here.
The percentage of families sent information that agree to participate, register, or in Cook County, consent, is 30% in New Jersey and 10% in Cook County.
The numbers for enrollment are not on here, but from the slides I just reviewed, you can see that this decreases even more. So what does it mean? I think there are three big takeaways that we'd like to share. Message number one, the QIC-AG developed a Permanency Continuum Framework. I shared it with you at the very beginning. The prevention phase of the framework includes universal, selective, and indicated. It's based on the Institute of Medicine's classifications for prevention efforts. As originally developed, the framework emphasizes prevention, offering services and supports that are preventative in nature, that proactively identify risk and protective factors, and put supports in place before difficulties that burden the family's capacity arise. We're learning about when and how to engage adoptive families in services and supports. And two intervals where adoption and engagement may be the most promising right now are looking to be universal and intensive. Although it's important to proactively reach out to families and offer preventative services, child welfare systems may have better success if they focus limited resources on sharing information about services and supports with all families who are eligible, which would be universal, and providing a variety of timely services and supports when families are starting to realize that they need assistance, as well as families who are actively reaching out for support. So these would be the indicated and intensive. Message 2. Child welfare systems need to provide post-permanency services and supports, but there's no single response that will meet all families' needs. Some will reach out when they start to experience difficulties. Others may not be aware of services or try to may be aware of services or try to manage their challenges on their own and not reach out for support until their family's in crisis. Regardless of when a family requests services, the systems need to respond quickly and offer an array of services that meet the unique needs of families. Systems need to consider innovative ways to staff post-permanency services so that workers are prepared to meet the needs of families effectively and efficiently when they reach out for service. When they need something, we need to respond. Services can't wait at that point. Message number 3. We need to counter the apprehension that some sites have that if you offer services to adoption and guardianship families proactively, you might break the bank. I know this was the fear that I expressed at the very beginning, that if you just said, hey, we've got all of these services, everybody was going to come running to them and try to receive them, and it would overwhelm the system, and people who didn't even know they had a need would be using services that maybe they didn't need. That didn't happen. So what we're seeing so far is families are pretty discerning about when they use services, and you don't have to expect that those services are going to break the bank. Compared to all the families formed through adoption and guardianship, there's a moderate percentage who will seek services from the child welfare system, even after outreach. And at the same time, we need to recognize that there are more children and families on the post-permanency side than in foster care. And in the context of permanent families, it is in the context of permanent families that children will heal and achieve well-being. Supporting families after they have made the permanency commitment is critical. Previous research shows that 15 to 18% of families that adopt or obtain guardianship will need services, and only about 5% will need intensive services. Next slide, please. Next slide, please. Thank you. So in summary, we need to focus on building a 21st century child welfare system, which means offering and sustaining evidence-based post-permanency services and supports. These services will need to, 1, be available when requested, be responsive to the needs of families, be supported in policy at the federal, state, and local level, be delivered by staff who can adequately meet the needs of families, be known by other professionals in the community, those that serve sort of as first responders to our families, teachers, courts, healthcare providers, and others. And so that accessibility is really there for all of our families as they need support. We also need to really change our messaging so that as families are preparing to move into adoption and guardianship, they can expect that we're going to be there for them if they need us on the back end. It's critical for child welfare agencies to rethink the lens that they use to offer services to adoption and guardianship families. These are voluntary clients. It is critical that when we're working with these families that we recognize that fact and that we think about that in how we work to outreach to them, engage them. Christina talked about the language a lot that we use, explain the services to them, and how we do those things will impact their desire to participate in service. The relationship formed between the system and the family prior to them coming into the system is also critical in their seeking out assistance from the system later in the journey. Child welfare can learn a lot about serving these families by looking at the research in the prevention field. Some of that we've shared with you today. And finally, there are many resources that have been developed by the QIC-AG. I encourage all of you to go to the website and check out the tools. Sign up for our listserv so that you can be notified when a new tool or resource is released. There are a few tools there that we want to mention. The website has intervention documents which go into more detail about the sites and their interventions. Each site has 2 of these documents. The first is on the website and can be viewed now, and the second will be released in October with even more detail about the interventions and their adaptations.
The website for site intervention documents is http://QIC-AG.org/partner-sites.
We have a catalog of programs that can be used, services that can be used with the QIC-AG's target populations. So that catalog kind of gives very quick descriptions of evidence-based and evidence-informed and promising practices all throughout the states and other places that show different types of programs that you might want to use in your site and how to reach the purveyors of those programs.
The website for intervention and program catalog is http://QIC-AG.org/introduction-QIC-and-program-catalog.
We have an implementation tools that can be used to help the site to assess their system, to determine what intervention they want to implement, and the tools to assist with the installation and implementation process. And John talked a little bit about how those tools helped New Jersey to kind of rethink and shape how they choose to do a program. Invaluable.
The website for implementation tools is http://QIC-AG.org/I as in India, M as in Mike, T as in Tango.
And we just released 2 documents that provide critical information, well written, critical information about adoptive about adoption for pediatric health providers and for educators. And those are already starting to get a really good buzz and are worth you checking out on the website.
John Webb, New Jersey. Email is john.webb, spelled JOHN.WEBB, at D as in Delta, C as in Charlie, F as in Foxtrot, .state.nj.us. Christine Feldman, Illinois. Email is christine.feldman, spelled CHRISTINE.FELDMAN at illinois.gov.
Thank you all for your attention. I'm going to turn it back over to Melinda.
Funded through the Department of Health and Human Services, Administration for Children and Families, Children's Bureau, grant number 90CO1122. The contents of this presentation do not necessarily reflect the views or policies of the funders, nor does mention of trade names, commercial products, or organizations imply endorsement by the U.S. Department of Health and Human Services. This information is in the public domain. Readers are encouraged to copy and share it, but please credit the QIC-AG. The QIC-AG is funded through a 5-year cooperative agreement between the Children's Bureau, Spalding for Children, and its partners, the University of North Carolina at Chapel Hill, the University of Texas at Austin, and the University of Wisconsin-Milwaukee.
Yeah, we actually only have 2 minutes left, so I think we're going to conclude the webinar. If people have remaining questions, please do continue to put those in the chat box because we can send out answers via that. So if the operator can allow that to stay active for another 5 minutes so that people can type in their questions, and then we will send those out to you. We truly appreciate you taking the time out of your workday today to be with us, and feel free to reach out to Christine and John, whose information was just on the slide before the question slide, or to any of us at the QIC-AG team. Have a wonderful day. This concludes the webinar. Thank you.